Hey,
And
I'm all right. How are you?
I'm
Doing? I'm Dr. Johnson. I'm the resident who works with Dr. Woosley.
okay.
I saw you had a wrist injury a while ago, like almost a year ago. What happened there?
In November,
What was the injury?
a scaphoid of my waist.
How'd you do it?
My scaphoid. Riding my bike,
Okay.
like bicycle, not like a dirt
Yeah,
bike.
I follow. Okay.
Like I literally go on my Instagram and show you. I like grind the handrail that's on the other side that
Oh.
goes down to Cooper River.
Yeah,
I literally grind my bike down.
Oh, that's cool.
That's what I do.
that's awesome. Recreationally, professionally, just something you like to do for fun.
That's cool.
Do you work?
Not right now. I haven't been working in 6 months. That's another thing Thomas put on there that I was working, but
What kind of work? Are you not working?
When this was originally, like, when I originally went to the hospital for it,
Yeah.
I was working. I was painting a house, the entire outside of a house in Woodbury.
Okay.
So I was, like, climbing up a ladder the whole time even. But I was holding a paint, like, pot in this hand. So, like, I kind of thought that I just, like, I don't know what it's called when your ligaments swell up, but
Yeah. So you thought you maybe just pissed something off in there.
yeah. just-
Okay. So you fell on your bike. It hurt you.
They prescribed me prednisone and 600 milligrams IV.
Did you go to the hospital after, or go
That was
somewhere
no,
and get
that
an
was
X-ray,
my
or
the hospital did X-rays and then
and said nothing?
yeah, they didn't wrap it or splint it or anything. and
Where'd
then-
you go?
Our Lady of Lourdes.
Okay, so I probably don't have those X-rays. So this
I
fracture
have them.
this fracture doesn't always show up on the X-ray right away, but
This is literally like all paperwork because like a lot of doctors did some promotion.
X-ray. This is here 11.
They said that they couldn't get it to come up, but this.
Oh, here we go. No, they called it. I can see the reads on it. So, agent determined non-displaced fracture within the scaphoid.
Yeah, but this is of my wrist and of my scaphoid, so that's what I'm curious of. Was my radial, like my radius broken at the same time as my
No,
scaphoid?
they're not saying that. Oftentimes when you have an injury in your wrist, we get dedicated wrist X-rays, and then there's a special view that they probably had you do where they had you like tilt out or do like a pencil grip sort of thing like that, and then that gets a special view of the scaphoid. So that's probably what they were talking about there. Okay, so you were seen, they didn't put you in anything, you went back to painting houses for a little bit.
For 4 months, 3
Okay.
months.
And then, did it ever feel better?
In intervals.
Okay.
But-
It never got back to 100%.
No, because I sat there every day going like this.
Yeah.
Like I'm breaking it every time I'm doing this.
Yeah.
Like I haven't done that because this time I definitely added that break up there to that break, I feel like, because before it was just my thumb kind of like, it just felt like I was like cracking the fluid out of it. I don't know.
Okay.
Yeah.
Yeah. All right. So, you're not working currently because of this. Is that what you're
Because
telling
of
me?
this, because of my car, because I have
Okay.
a bunch of doctors telling me that I have a developing brain disease last year, and then coming into this year, it went from progressive encephalomalacia to possible focal encephalomalacia,
Okay.
which are two completely different, like,
Yeah, that's a little different language for that.
yeah,
Okay. Are you lefty or righty?
right,
Okay. Do you smoke?
yeah,
How much do you smoke?
like a quarter to half a pack of cigarettes.
These are your X-rays. These are from September 12th, so last week. This is your scaphoid bone right here.
Mm-hmm.
That's where the break is, right here. Because this all should be one bone.
Yeah.
And obviously yours is in two pieces. The other thing that concerns us in looking at this X-ray is you see how much whiter this looks compared to the rest of the bones around it.
Mm-hmm.
That's called sclerosis, and that's concerning because that can be indicative that it doesn't have good blood flow. which is common with a scaphoid fracture, where this part of the bone isn't getting good blood flow, and now it's, one, not going to heal without help, and two, that bone is effectively dying. So, can I take a look at your wrist out of that brace? How much does it hurt you, like day in, day out?
Like doing that hurts really bad.
Okay. Can you come all the way up as far as you can? Can you do it with both sides so I can compare them?
That doesn't really like,
Yeah, that looks the same. All the way down.
that definitely feels like,
That bothers you?
uh,
You can tell it's doing something.
it has to be like it's like here and
Yeah.
here that it's like.
That's where the two ends of the bone are. So that doesn't surprise me at all. Yeah. Alright. Can you turn them all the way over?
So I seen one of your guys' orthopedics, and is that Washington Township? I don't know, it's right off of 55 and down
Oh, yeah.
towards the college.
Uh-huh.
I tore my ACL and everything.
Oh,
and
boy.
when I went and seen
Is that a
them-
biking thing?
Yeah.
Yeah. Does it hurt anywhere in here?
Honestly, like right where like the scaphoid bone is, that's about
That's
it.
it? None of the rest of it in here?
Surprisingly, like, no, it's more like when I stretch that.
You
like,
mostly
it's
feel it
only when
like
I
that.
go that way, yeah.
In here?
You're not really pushing. I feel like if you'd have to push like
Okay.
to
I don't wanna like,
to kind
hurt
of
you,
make
hurt you.
it. Well, my pain tolerance is like
yeah. What sort of medical problems do you have?
I don't.
Good. So you're otherwise healthy.
I mean, other than whatever they want to say was like,
With this encephalomalacia.
but that's because of like I already told them like the only thing.
What prompted them to start working that up? You just, what sort of problems were you having?
I was about to pass out in my car. I was getting blurry vision.
Okay.
My ears still like my ears still ring right now.
And so they
but,
did some head scans and,
I asked for blood work to be done.
yeah.
And my primary care went from being real nice and sweet to telling me you're just a know-it-all, aren't you? So I feel like she knew the whole time that I had carbon monoxide poisoning.
Oh, okay.
Medical history, I'm bipolar, OCD, and
Okay.
I mean
Do you
that's
take
like
medications for that?
I take 5 milligrams of Adderall,
Okay.
but I just started that again because 2 days before going into hypoxia, I started 10 milligrams of Adderall, and then like driving my car, I started feeling weird. So I'm like, that probably did save my life at the time, taking the Adderall, because it would have started like serotonin and all that shit in your
Yeah.
brain and make it flow on its own. But like, yeah, I stopped taking all the medicines, like,
Got it.
and went back to kind of just like trying to do it naturally.
Well, with regards to your wrist, at this point you have what's called a scaphoid non-union. And you actually have some signs of sort of the sequelae of a scaphoid non-union, which we call a snack wrist, which is where all the other bones are sort of in a delicate balance with your scaphoid, and when it doesn't heal, they all start to shift. So this is your lunate, and it should be sitting flatter like this, so it's starting to shift this way. This scaphoid bone right here should be sitting up more like this, and it's starting to flex that way. So all of your wrist bones sort of start to move, and this can lead to progressive arthritis throughout your wrist. Right now, we don't necessarily see that all throughout your wrist, and you're not showing me it. You're just saying it hurts where the scaphoid is, but ultimately that is the natural progression of this sort of injury. So there are surgeries that we can do to try and fix this. Unfortunately, because of how far along yours is and because we're seeing this sclerosis, there's no guarantee that fixing it is going to actually work.
Yeah, I don't think that's gonna fix anything.
So, well, we would have to do more studies to sort of look at it and see if that's
And
feasible.
the whole thing I'm worried about it doing surgery is like putting me under anesthesia, because my brain like just went through chemical like
Yeah.
and balances and a half for like I'm telling you, 3.5 years, like a shake. My car, you take a first response carbon monoxide detector, they come in and install a hot water heater in your house, or a air conditioner in your house, anything, like, they hand you one. Go take it up to the car vents of my car, it literally will go off.
Yeah. Well, there are other options than just fixing it. There's an option of just taking it completely out, and then you fuse these four
Yeah,
parts
that's
together.
what I was curious of, like,
So that's the second option.
Like, what I'm worried about is, since it's been so long and it usually has like shitty blood flow, yeah, but like, does it depend on if you're active or not, the blood flow and everything?
No, I don't think that's going to be as big of a difference maker for you. I mean, it can help if you're young, it can help if you don't smoke. But at this point, it's more of an anatomic issue, and yours has already sort of gone on to the progression of it's not going to heal. This isn't something that is ever going to heal in a cast.
Have you ever put anyone under anesthesia with carbon monoxide poisoning?
Not recently.
Yeah, but like, have you ever?
Sure, yeah.
Like,
That's something, I mean, we take care of all sorts of sick people. We have anesthesiologists that are specialists in this sort of thing, so we can, and there are options that don't involve going all the way under too, so that's something that we can.
an
think about.
anesthesiologist isn't a toxicologist though, like a toxicologist is.
No,
the
but
one
they're
who-
specialists in managing your airway, and they,
Like, it's not like a thing nowadays, that's why all these doctors, like, from here didn't catch it, because all them other doctors, like, already gave them something to go off of.
yeah, it's tough when you're just following the trail that someone else laid for you.
And then they can't access records that, like,
Yeah.
that's what makes it even, like,
No, I'm not concerned with that being a major issue. I think we would have you see our anesthesiology colleagues, and if they felt that further workup was necessary, we would obviously make sure that we did everything to make it safe for you. But I don't anticipate that being an issue.
I wouldn't want to take, like you're talking about, like, how they do, like, surgeries and they kind of give them, like, Xanax and shit, and they're, like, mildly awake,
They
but
make
not.
it, you don't remember it, you're asleep.
Yeah, I don't want that, because I'm that one person that will have, like, the experience where I would remember or feel and not be able to tell them that I feel, because I'm.
Well, those are sort of our options right now with regard to your wrist.
What about laughing gas? Like, the dentist would put me on laughing gas, like.
They have stuff that's similar. Let me go grab the boss. Let you think about those things that we just talked about. And we can. I'm not.
I just don't want to die, dude. Like,
Yeah.
the last, like, year was.
You've been through it.
Yeah.
All right. Well, we'll.
Like, I don't doubt her. I just doubt the whole. My brain mixing with anesthesia having.
That's why we have them meet you beforehand. Yeah.
Maybe do like a brain scan or two before.
No, we
No,
have them
like-
meet you beforehand. Take a deep dive on your chart and make sure that they feel safe with it. All right. I'll be right back.
Alright.
Okay.
Yeah.
I'm Dr. Woosley, one of the hand surgeons. Okay, so I heard from Dr. Johnson that, you had some issues of carbon monoxide poisoning, that you've been getting treated? Okay.
No, I wasn't treated for it. None of them treated me.
Oh, you
But
haven't had any treatment?
I had to go to Dick's and buy oxygen boost because no one would give me oxygen treatments.
Are you still getting oxygen?
No, and my levels came down to a 7, so I just kind of went back to.
Okay, so you self-treated?
Yeah.
Right, okay.
Well, Virtua called me a hyperbaric oxygen chamber, and when I went to make the appointments, they don't treat carbon monoxide poisoning with hyperbaric oxygen chambers, they said. No, that's just wrong. I had acute carbon monoxide poisoning, and it was longer than 6 hours, so putting me in a hyperbaric oxygen chamber with pressure could just cause another intracranial. So they were smart for not doing that. I did hypothermia pads and sucked on oxygen from Dick's.
What questions do you have for me about your wrist injury? This has been since
Is it skin?
November, is that right? November of last year? Okay.
Yeah. I think like the carbon monoxide was probably making nerves numb, probably not feeling it, that's probably
Okay.
part of it, but
Well, how do you feel now? How does it bother you? Do you have pain?
going this way, yeah. Going that way, not really, like down, it's in there.
Okay, that
And
makes sense.
up, like not really at all.
Mm-hmm. How would you rate your pain?
I'm more worried about going under anesthesia. Like, I don't want to die going under anesthesia.
Okay.
I don't know how my brain's gonna like react to that
Mm-hmm.
after like carbon monoxide, and if you look at all the things that they said happened to my brain from the carbon monoxide, like I went into hypoxia, had agonal breathing, was into corticate posturing.
Okay.
I was like 2 minutes away from dying.
Okay.
I don't want to die.
Sure. Well, you don't have to get surgery.
I know. But if you recommend surgery, then
Well, you're still smoking cigarettes? Quarter pack a day?
yeah.
Is that right? Okay. So I can tell you that your x-rays here, I mean, this has been going on for a long time. You see the break, okay? Unfortunately, your whole bone on your x-ray looks white. What that means is that the bone has died.
Yeah, I kind of figured that. That's why my skin looks like that, right?
It could also just, how much have you been wearing a splint?
Never.
Or you don't wear the splint at all?
This?
Yeah.
Oh no, just from when you guys gave me it when I went to see
From Tom?
40, yeah.
Yeah.
And then I had like a wrist brace, but it's not like this. It would keep this immobilized
Mhm.
really, and my wrist could still, that's probably
Itself
why
up.
it's kind of stretched.
Okay. You can wear the splint, if it makes you feel better, then you can wear it. There's no reason to put you in a cast or a full-time splint because this is not going to heal. That ship has sailed. Yeah, it's not happening.
I believe you.
The bone is also dead, which complicates things.
Cause that's gonna start killing my other bone, right? Or no?
No. No.
Is that
The
it
bone
won't-
death will stay just to this bone.
Alright, what happens if we take that bone out?
Well, when we take the bone out, the option is that we remove this bone fully, and then you can't just leave it as is. We can fuse these 4 bones,
Yeah, with screws and pins. And...
screws, make them heal together. But I would only offer that to you if you're not smoking cigarettes anymore. Because if you're smoking cigarettes, there is a high risk that you will not heal the fusion surgery. The other way surgery is, besides removing the broken bone, the scaphoid, we take out the entire first row. 1, 2, 3. These 3 bones get fully removed. Then your next row of bones, right here, that settles in and that becomes your new wrist joint.
What happens if you leave a dead bone in there?
If you leave a dead bone in there, you start getting arthritis, which you already have signs of. We call this arthritis a snack wrist meaning scaphoid, non-union, the broken bone, never healed. And then the A means advanced and the C means collapse. So that's the type of arthritis we get.
They don't make a little scaphoid bone
You
that you could
are,
just pin to your radius.
you're
and
stage one, you're stage one arthritis already.
They don't. Why don't they? Smith and Nephew don't do that, or any of them? I deliver like hip implants and knee implants.
No, we don't have an implant for this, yeah. So this bone has a high chance of this happening because it doesn't have a great blood supply. So when you break the bone, the blood supply gets disrupted and then it never heals on its own. So at this point, it's either you leave it, you wear a splint, the brace, when you need to for comfort, or if you want surgery, it would have to be reconstructive surgery because now you have arthritis already. Being a smoker for you, I would offer you the proximal row carpectomy, taking out all 3 bones.
That's the
That
best
is it.
for a smoker, is taking out all 3 bones?
Yes.
What's the recovery time on taking out all 3 of them bones?
Typically, it's a 3-month recovery. You have a big incision on the back of the wrist. We need that to heal. Still being a smoker, you may have, a longer time healing the scar, but it's just soft tissue. It's your skin. Usually it takes 3 weeks to heal the scar. In terms of your motion, usually from the break baseline, you lose a little bit of motion from your normal, but the surgery, people lose 20% of their motion range, and your grip strength also gets decreased about 20%. You're in a splint after surgery for 6 weeks, and you do 3 months of therapy after.
And what was the other one? You just removed that bone only?
You can't take out that bone only. It's not even a surgery we do because you get like a devastating,
What if you put a
all the bones basically.
What if you put a
fall out
pin
of
through
place.
it? So then it's not like just floating and crunching.
So if I saw you right when the break happened, fresh break, then yeah, we could have put a screw in it to make it heal. Putting a screw across a dead bone will do nothing.
These dudes, they could have just put me in a splint.
Yeah, so, I mean, you're definitely entitled to get another opinion if you don't like what I'm telling you. You could definitely go see what another surgeon has to say, but, that's the situation.
The front of the bone, that's what I'm trying to figure out, because it's like the top of the bone's all white, and then if you like look at the front where it's connecting to the
Here,
yeah,
you have a sliver of bone that's still alive, a sliver.
yeah.
The blood flow goes.
But is that,
comes
well,
around, goes
if you
on.
were to take an x-ray from the bottom point, is it,
We have multiple views
yeah, that's
here.
what, it shows the whole entire whiteness even through the bottom point of the bone?
You're all white here. This view actually makes it seem worse than the other one. You're all white here. Your break line is not white because what happens is when you break it, you actually, you get bone loss and it starts filling with fluid. And that fluid makes it turn a little bit black. It looks like somebody has little munch out, like somebody's nibbling on the bone there. Those are all cysts. It's not healing. Looking at the side view of your wrist, this bone right here that looks like half a shape of a moon, that bone is now out of place, it's tilted backwards. The scaphoid bone has munched up, it's flexed forwards, that means your break is out of place. So it's broken, it's deformed, and now you have arthritis. And the bone's dead. So it's definitely progressed. See on here. You see this side. me touch you?
Mhm.
You have good pulse. Let me see your motion, both your wrists, like this. Show me how well you can extend.
I think my left one I can.
Yeah, so you have less extension here. Does that hurt you? When you
No,
do
it just
your
feels like I need to stretch. Honestly, that's what
Exactly.
it like. The more I don't know.
Go down, flex.
That hurt. Like that hurts. If anything,
Yeah,
in
30 degrees.
there.
Yeah, it's not that much. I mean, you're able to flex this one 30 degrees, and this one you're about 90 degrees. So you have at least 60 degrees lost in motion. And
Yeah. So if
this-
I take them 3 bones out, it's gonna.
You'll be able to move your wrist, but
I'll be
It's
able to
not
move
gonna
it more
be-
than I am right now, right?
probably, but it's not gonna be like this right wrist. Your right wrist is 55. It's not gonna be like your right wrist. Does that bother you? You have minimal deviation, you're like.
Yeah. I can kind of tell that it's out of place and like it's just bothering me that I have to go through like.
Unfortunately, the only way to do surgery like this, you do have to go under anesthesia. I understand if you're not comfortable, going under anesthesia, but you can't.
No, I've
you
been
can't,
under
you can't,
anesthesia
You can't do the
before,
surgery
but-
awake.
No, I know. I don't want to. That would be traumatizing.
Yeah.
I don't know how you guys do surgery. It's
Anyway,
not
you think you can-
traumatizing.
Anyway, you think you can stop smoking?
I don't know. Does smoking have anything to like?
Smoking has more risks of getting anesthesia, controlling your airway. It has a higher risk of getting infection from any surgery, slower time to heal from surgery, wound complications. So yeah, there are risks of being an active smoker and getting surgery. As well as sometimes, when you smoke, we don't offer you certain surgeries anymore. We don't offer surgeries that have a higher risk of not healing.
So you would only take those 3 bones out? That's the only surgery you're recommending?
That's the only surgery I am comfortable recommending to you. Yeah.
And the other one you can't do because I smoke cigarettes?
Right.
Is the other one like give you more mobility?
The removing one and infusing,
Worse mobility?
it's exactly, the outcomes are the same. The outcomes are exactly the same, with different risks. The main risk of fusing is number 1, you don't heal the fusion. Number 2, the hardware, the metal we put in can get loose, infected, or pull out. So that's why I'm not offering it to you, because we don't.
If my only option to make my hand feel like normal is getting surgery, then that's my only option. I'm not gonna deal with.
Do you feel comfortable setting up surgery, or you wanna think about it and then
No,
come back?
set up surgery because like I'm tired like of dealing with all the bullshit.
Of removing the 3 bones?
Yeah,
Okay.
like if that's the best thing to do, then like
Okay, so it's outpatient surgery, you go home after. Anesthesia, you do get put to sleep, but the anesthesia doctors do a nerve block before the surgery starts. They put a needle by your collarbone, they numb up your whole arm. It's numb for about 12-24 hours, it really helps your pain. I still recommend that you try your best to cut down on smoking, ideally quit, if you can. You cannot get your surgery site wet at all until your 2-week post-op check. Keep it dry, and you're in a splint after. You want to keep that on. Your scar is about that long. Okay? You take out the 3 bones that way. There's a little nerve that sits on top of the bones right here. That nerve only does feeling to the back of the wrist. We actually remove that portion of the nerve, and that helps with your pain control after. You still feel the tips of your fingers totally fine. Okay?
I'll still be
You
able to
just-
ride
you
a
just-
bike and like do the things that I do on a bike.
What do you do on a bike?
Spin the bars, do tail whips, 360s.
Eventually, but you're not gonna be able to do it right away.
No, yeah, like
Yeah.
that's all. I just want to go back to being able to like.
And are you working currently?
No.
No. Okay. I mean, eventually we'll get you there. But in terms of riding a bike again, it could be 6 months to a year. This is a reconstructive surgery.
There's no way of doing electric stim therapy, like trying to heal the bone with electrical stim.
A bone stimulator?
Yeah.
Once the bone is dead, it's dead.
It's
Can't revive it. Can't do CPR.
I'm gonna have you stop for
Yeah.
years. I'm
Okay.
sorry.
Alright, so wait here, we'll get a surgery permission form, okay?
Thank you.